Good afternoon, everyone. Another important and successful meeting of the National Cabinet today. There is no country in the world that is not dealing with the issues of COVID-19. Over the course of just this past week, I've had the opportunity to speak to Prime Minister Trudeau, as well as President Macron last night, Prime Minister Netanyahu last night as well. One of the key challenges we all have is whether we're Prime Ministers, Premiers, Chief Ministers, you've got to continually be learning about this virus, how it spreads, how you stay on top of it, how you get on top of it. And the swapping of information, the collegiate approach that has been taken from everything to how's the best way to run a testing regime and tracing regime to working together to ensure, as Australia is, to achieve a vaccine, and not just achieve a vaccine but ensure we get access to the licensing arrangements to ensure that CSL can be here and producing the vaccine at the required quantities to ensure that we can vaccinate the Australian population, and then working with other countries to ensure that is also occurring. There is no shortage of issues that we must address, and that was also the case today as we came together as a National Cabinet. And of course we focused first and foremost on the challenges that are in Victoria and New South Wales, and again expressed our strong support to Premier Andrews for all the work that is being done there and the tremendous resource that is being applied to that, not just by the Commonwealth but all states and territories. And once again Premier Andrews was very appreciative of that support and the collegiate way in which all Premiers and Chief Ministers in the Commonwealth are working together to assist with dealing with the outbreak in Victoria. While there is some better news today out of Victoria, that is not something we can assume will continue, and so we must maintain the full force of effort in Victoria. In New South Wales, the news is better, and I think what this demonstrates is that we're in this fight, and in some fights we'll be behind and in some fights we'll be ahead, but we're always in the fight in Australia. And what it demonstrates is that you can deal with outbreaks, you can get on top of them, but you've got to be constant about it and you've got to throw everything at it. And we will get on top of it in Victoria because there is the determination and the cooperation to achieve that, and that was reinforced today. Also, I want to stress that all other states and territories remain on alert, and there is very much that sense around all the other Premiers and Chief Ministers today, where in many cases, like in Western Australia and South Australia, they haven't had community transmission cases for over 100 days. They are just as alert to the risks in their jurisdictions as New South Wales and Victoria are, and that's important. I think the events both in Victoria and New South Wales are a reminder the virus is still out there, it'll still make its way and it'll still throw everything at us, and we must be prepared to respond. And so in relation to that, there are a number of measures that are continuing. I just want to update you that there are currently, we have some 3,105 ADF personnel which are deployed around Australia under Lieutenant General Thruin's command that are actively engaged in dealing with the COVID-19 related issues. Now, the majority of those, just under half of those, are actually in Victoria. But we have 550, for example, in Queensland. We have 672 who are in New South Wales. There are 141 working federally on this issue directly. There are 114 in South Australia, 57 in Western Australia, and 102 up in the Northern Territory. So the ADF is involved both in the front line of outbreaks as well as in the operations rooms and command centres all around the country, providing the support that is needed. The tasks are involved in everything from tracing and to, as you've learned today and I indicated early this week, knocking on doors. Where the manual tracing over phone and technology related is unable to reach people, then we're knocking on doors in Victoria. And this is a challenge in particular communities, and that's the experience in other parts of the world as well. A couple of other points that were agreed on today was an affirmation of the suppression strategy that we've been working to nationally now for many, many months from the outset. The goal of that is obviously, and has always been, no community transmission. There will always be cases that come because Australia has not completely shut itself off from the world. To do so would be reckless. but that no community transmission, where the vast majority of states and territories have been at now effectively for some time, and that's certainly where we want to get back to in Victoria and New South Wales, and that's where our efforts are focused. We also adopted an important principle, but this is particularly relevant in times of outbreak, is the need to ensure that your emergency response and your health response are integrated. There is a health response, which Professor Kelly can speak to you about, but there is also emergency management responses, supporting towns, particularly in regional areas and things of that nature, and there's a lot of logistics and coordination that needs to go into the emergency response, and so the health and emergency side of these things must be fully integrated. That is substantially occurring, and we've just decided to tighten up those processes and procedures to ensure that that occurs even more so in the future. We agreed to a even more comprehensive set of national data measures that are necessary to ensure that we are collectively aware of what is occurring in all the states and territories, and that we're picking up at the earliest possible opportunity where there may be some vulnerabilities, and Professor Kelly will speak more to that. That not only goes to case numbers and things of that nature, which we've had for some time, but how quickly cases are being identified, contacts are made, isolated, tracing done for known contacts, and then isolation and testing of those. Our testing regime remains very strong, but and particularly in terms of reagent and the kit that is required to do all these things. But given the scale of testing that is taking place, particularly in New South Wales and Victoria, we're working to further upgrade the support we have for labs around the country to ensure that we keep up that pace, which we will. We also agreed and adopted a freight movement protocol, particularly relates to the movement of large freight across borders and the protocols that are needed for the drivers and how they act and how often they're tested and all of these types of things. And we agreed that we needed to go further than that, not just a protocol, and we have accepted the advice of the AHPPC, the medical expert panel, on that protocol, but all state and territories and the Commonwealth agreed that that needed greater enforcement and it needed to move towards a code, and that's where we'll be moving over in the days ahead to formalise that further. And the enforcement of that will obviously be put in place by the states and territories who have those resources. Now, how they do that, whether that's by legislation or public health order, that'll be a matter for them. In Queensland, for example, they have public health orders that can attend to that, but the states and territories will move on that. Now, on the economy, we heard from Stephen Kennedy, Dr Kennedy, again, as is the normal practice at National Cabinet, where we're able to brief on Tuesday's announcement on the JobKeeper and JobSeeker, and of course the economic statement that was released yesterday, and the Treasurer will be speaking to at the National Press Club very shortly. Those measures have been greatly appreciated by the states and territories. Combined with our health response, the Commonwealth's balance sheet and direct fiscal measures now is in excess of $300 billion. The state's response, which builds on top of that, is around $42 billion. And so there is a strong platform for states to take additional economic measures where they see the opportunity to do that. And this very, very significant platform of fiscal support and balance sheet support that the Commonwealth has provided enables every extra dollar they spend at a state level to go that much further. We also agreed today, and I think this demonstrates just how effective the National Cabinet is, not just directly on the health measures, but today we agreed to fast-track processes for those 15 major projects I spoke to some weeks ago. There's some 66,000 jobs in those 15 projects, and they're worth about $72 billion in economic activity. So 15 major projects agreed for streamlined approvals processes to get these happening as soon as possible. It was also agreed amongst all the states and territories to move to a single-touch process under the EPBC Act, and that we would now be moving to deal directly for interim standards with some model jurisdictions and forming bilateral agreements with all states and territories to action that agreement. 7 out of 8 states have also signed up to the skills agreement, the job trainer agreement, and we welcome that, and that has moved very quickly in the last week or so. And the final point that was made in Dr Kennedy's briefing, and I'll pass on to Professor Kelly, is in relation to our goal when it comes to jobs. Our goal is to create jobs and to reduce the effective rate of unemployment. Now, I know there's been quite a bit of commentary, and the Treasurer has addressed this also, and I'm sure will do so more so in his presentation today. I can understand that Australians would be concerned, rightly, about seeing the measured rate, the headline rate of unemployment set where it is in the forecasts that have been released by Treasury. What the headline rate or the measured rate of unemployment doesn't take into account is changes in labour force, people who are on effectively 0 hours. What the effective rate of unemployment does is it does take that into account. And one of the key differences in this pandemic is the quite significant gap that exists between your effective rate of unemployment and your measured or headline rate of unemployment. And I would urge, because I can assure you, that's the figure I'm looking at, because the effective rate of unemployment means who's got a job and who's working and who's getting paid. That's what it means, and that's what we have to focus on. And so while the headline rate of unemployment has been moving up and is expected to continue to move up, the effective rate of unemployment back in April was around 15%. It fell to 13.9% in May, and it fell to 11.3% in June. That shows the improvement in the labour market. You will see a difference between the movement in the effective rate of unemployment and the measured rate of unemployment. And that's what Dr Kennedy was briefing the premiers and the chief ministers on today. So our goal is to see that effective rate come down. And we've said right from the outset, the Treasurer and I, when we talked about the figures on the headline rate some months ago, we know that the rate was higher. And so we've done the work to actually assess that and identify it. And they're the figures that I've referred to. So with that, I'll pass you on to Professor Kelly. Thank you.
Thank you, Prime Minister. So what we discussed in National Cabinet today was the normal update of the epidemiological situation in terms of the COVID-19 pandemic here in Australia. I'm sure everyone knows that the major issues we're facing at the moment are in Victoria, and particularly in Melbourne and the Mitchell Shire. And there is a much smaller number of cases that have been appearing in the community in New South Wales. So I gave that update. We talked about what that meant in terms of the capacity and capability to respond across the nation, but particularly in Victoria. And so that was the update from me. The main issue today was to recommit to that suppression strategy, but to really demonstrate how aggressively we need to chase down every case, every day, to ensure they are isolated, to make sure that the contacts of every case are also contacted themselves and where necessary be tested and isolate as soon as possible. That is the crucial component of our public health response. It has been from the beginning, and what has happened in Victoria over the last few weeks has demonstrated firstly how difficult that is, and also when you get a large number of cases that really exacerbates it. But that is the crucial component that we need to stress, and everyone at National Cabinet agreed to that. The second component is to continue with those personal issues we've been talking about all along, those personal protective measures about hygiene, about physical distance, if you're sick, stay at home, and all of those messages, they remain important even in the states where there is no community transmission, and all the premiers signed up to that as well. There are other measures that may need to support that public health approach and those personal protective measures, and that was also part, as it always has been, of our suppression strategy with that aim of no community transmission. That's our ultimate goal. 6 out of 8 jurisdictions are in that spot at the moment, and our absolute focus now is to continue to work, particularly with Victoria, to get back to that situation. So to support that plan, that continued suppression strategy, a series of metrics to give a much more granular picture of what is happening, as the PM has suggested, was agreed. And that will lead to much better sharing of that information to guide the public health response where it's needed, and particularly to guide what sort of supports can be put from other states and territories, from the ADF and other resources where we are in that situation as is occurring in Melbourne. So to give you some examples of that, it's really about cases, how long between the test being done to the test result being related. We will want that regularly from all of the states and territories to make sure that that testing regime is remaining as it should be. How long from when that test is made available to the local authority until that case is contacted. And the aim there, absolutely, just to really stress it, is every case, every day. So we're really pushing hard, making sure that that information is available. On aged care, because that is such a crucial component, and we know from all around the world that our most vulnerable people are our elderly, and particularly those in residential aged care. And we've seen some of those issues really emerging in the recent days and weeks in Melbourne. So we're asking for very granular information about that to guide our response. Similarly with the tracing and contact tracing and contacting those, and some other measures related to healthcare and particularly intensive care. So those are the flags, that's the metrics we've agreed to. We've agreed to certain flags that will demonstrate that there are issues, and a commitment again to sharing and transparency across the nation so that we can assist where we need. That commitment to being ready even if we do not have community transmission, and assisting across the nation wherever that's required, whether that be the Defence Force, other health departments or others as is required, and particularly in relation to our emergency management colleagues. So I might leave it there, PM.
Thank you, Professor.
Some industry groups have said that the tougher eligibility test under JobKeeper 2.0 will be the death knell for them. So I'm wondering whether you'd be willing to consider changing that eligibility test so they only had to show a 30% reduction across the 2 quarters, June and September, rather than in both of them.
Well, the test that's been set out is over the quarters over which the program has been running. And JobKeeper is intended to be there for those businesses who have had a sustained fall in revenues as a result of COVID-19. And that's the measure that has been established. I note that in other jurisdictions, they've actually applied an even tougher test on the second tranche of their measures. We didn't agree with that. The whole point here is to support businesses that have had that significant impact. That's what it's there for those most impacted, and that's what the policy is designed to do. But it's also why we believe for all firms that have been on JobKeeper up until now, that we believe it's very necessary for them to continue to have the industrial relations flexibility post the end of September. Now, I also stress that the existing rate of JobKeeper will continue till the end of September. So that is still several months away. And we would certainly hope that as events unfold, that many of those businesses would see an improvement.
In the month of June, for example, though, the automotive industry had a weird uptick in sales, something they weren't expecting because of a variety of reasons. They say that in itself, that 1 month of uptick in sales, is actually going to make them ineligible for JobKeeper 2.0, but they're in dire circumstances and in a very bad position in most of the June quarter and the September quarter. So how do you respond to an industry that just sees no future beyond September 27?
Well, I'm very pleased that they had that uptick in June, and I believe that probably had a fair bit to do with the instant asset write-off arrangements that we put in place to actually encourage people. So I'm glad that they've been significant beneficiaries of the tax incentives that we gave to businesses to actually go out and support them. I mean, that's what all of our measures are designed to do. We want businesses to be able to graduate out of JobKeeper. That's the point, not for them to remain permanently dependent on JobKeeper. And businesses will be making lots of decisions over the next couple of months. The government is making lots of decisions over the next couple of months. We need to get, as soon as we can and as best as we're able to, in a situation where we have fewer businesses dependent upon JobKeeper, and that's the plan that we set out. Of course, the ATO, just as they have right now, to deal with distortions, I suppose, in the data or unusual events that occur in the data. We went through a lot of that early on in the process, dealing with businesses that had turnover impacts because of bushfires and because of drought. And the ATO took that into account in making their assessments.
Minister, what was the tenor of the EPBC Act discussion?